Welcome to the CommonWell Health Alliance nationwide Care Transition Interoperability Showcase. What you're going to be seeing is 7 CommonWell members featuring their services built into their software. Today what we're excited to show with you is not just a demo, it's not just a presentation. This is something that we do live every single day across the nation. And if you're not familiar with CommonWell Health Alliance, we are a not-for-profit trade association made up of a variety of different organizations who are really focused on the availability of data across the nationwide. So as you can see on the slide in our mission, we're open to all healthcare IT organizations and others who are really focused on that data sharing, regardless of where the care occurs. And we believe that it should be built into the software that the providers are using today and at a cost that's reasonable to both the provider and to the individuals that they serve. We are nearly 80 members strong, but today you're going to be seeing 7 of those members representing 6 different care settings. Our members together have well over 20 care settings, but we'll see 6 today. So, the story is really going to revolve around Cynthia. She is a 66-year-old, very active grandmother who lives in Florida, but her daughter and her grandchildren live in Colorado. So you can imagine she spends a lot of time going back and forth between the states. In the span of about 20 minutes, we're going to take you through 5 months. We're going to take you across 2 different states, 2 different health issues, and about 2,000 miles where her providers will be across. And you're going to see some of our CommonWell services in action. So we're going to talk through our patient enrollment. We're going to talk through record location, patient identification and linking, and our data query and retrievals. And there's some really cool features that we hope you'll be able to see in here as well. You're going to have correlated linking. You're going to see our CommonWell broker and record locator services. You're going to have a chance to see HL7 Fire used to both query and retrieve those documents. And you're actually even going to be able to see direct patient access to those records. And as I mentioned earlier, all of this will be built into our member software directly, so the provider will access it where they're used to accessing documents within their own organization. And this is all with the thought that our patients are the center of care. And we're really looking to help inform better care decisions, help reduce those readmissions that we're seeing, and reduce the cost that it's given to give care, as well as increase provider satisfaction and ultimately improve the quality of patient care that the patient is experiencing. We have some of our members, and myself included, who've talked about the reams of paper that you have to carry around to coordinate your care. I don't want to have to worry about those reams of paper. We want you guys to just be able to go on living your life, doing what you're doing, and let us help coordinate that care. So I'm going to kick off to my colleague at eClinicalWorks and have you all turn around.
Thanks, Jennifer. So we'll take the story forward for Cynthia. One fine day during her morning walk, she experienced sudden shortness of breath, and she called the PCP office, which is played by eClinicalWorks in this story, for a same-day appointment. Taking the story forward, Cynthia is already present in the hospital and has marked arrived. In this particular use case, we'll see the enrollment process of a patient, Cynthia, an eClinicalWorks office to the CommonWell person's record. So to begin with, we'll look into the patient consent. So once you click on Info button, then on Additional Info button and Structure Data, it shows you consent to share data with external entity. What that means is any value that has been marked here, depending on those, either we can send the data to the contributor or receive the data for Cynthia or opt out. Opt out will clear any entries for this particular patient. So keeping her on send or receive, we move out of this screen and go back to our appointment screen. Now the main thing is, since the practice is connected to CommonWell and all the patients are already signed in, we will hit the CommonWell button and try to enroll the patient. But in this case, Cynthia Garcia already have a green tick mark right in front of her name. That means as it hover as well, it's enrolled to CommonWell, which means there was only one patient record or person record that was found in the CommonWell network, and ECW automatically linked the patient with that because there was only one person. If there would have been multiple, then the provider or office manager would have got an option to pick one and link. So the third part of the screen that you're seeing here are basically network links that are linked to this person in CommonWell. What does it mean is the person has already seen in Greenway or Meditech or somehow related to it. Okay. Now, as a appointment process, office manager can mark yes or no, asking the patient there whether have you been seen to Greenway, which lies here, all those things questions. And once a provider marks a no, suppose this one is Sandy, and if we mark a no here, then this link will get upgraded with the reason, and it will never show up in the enrollment screen. This concludes the enrollment process of this patient, which was on ECW right now, to on the CommonWell network. What this allows is for Meditech and Cerner and Greenway to receive the patient data whenever they need to. Now going forward with the story, we'll start looking into the progress note and start filling in the medical summary for the patient. As the patient has arrived with the shortness of breath, with rapid heart rate and dry cough, and going through the medication and allergies, what provider thinks that she could be a symptom of probable pulmonary embolism and advise her to go to visit the nearest ER as soon as possible.
Hi, my name is Joe Wall. I'm from Meditech. So we're going to continue Cynthia's journey now. She's coming to the ED department at the Meditech facility. So as we saw with the primary care visit in the eClinical Works, that she has shortness of breath. She's suspected of pulmonary embolism, but she's now at the ED department where we're going to register her. We're going to do some diagnostics, some lab results to confirm that diagnosis. So Cynthia will now be registered in the ED department. And what we're going to do is that once upon registration, we're going to automatically query to the CommonWell broker using HL7 FHIR transactions. And what that will do is that CommonWell, being the broker, is going to do the fan out of those requests and look for any other CommonWell organizations that might have a medical summary on Cynthia, including the primary care visit that she just recently visited in the eClinical Works. So what we can do upon registration, we're going to get alerts within the desktop where we can acknowledge, because I see the CCD coming from eClinical Works and this is of interest to me, so I'm going to acknowledge that. And what will happen is that that'll automatically put that CCD document right into the patient's chart. So if we move to the patient's chart, we will now see that the CCD that we got from eClinical Works is now available to be seen right within the physician's workflow, in this case just the physician care manager. I can see this by under medical summary. I can see that the continuity of care document is now populated in, and I can view that, and I see that's from the primary care visit that she had earlier today. Since we're using HL7 CCDA structured documents, it is a human readable view as you just saw, but we can also parse some discrete elements such as medications, problems, analogies. As you can see on the screen, we see external data available. And what that allows us to do, we can do some reconciliation based upon those elements, such as medications. So if I want to bring those medications forward on the patient's chart, all I would do is simply hit yes. If this happens to be a duplication, I wouldn't necessarily have to bring that forward, and I would just select no. So by hitting yes or no, we'll bring those elements right into the patient's chart. So now that information will be made available if we get queried by another organization downstream. So we're going to be taking some lab results on her. We're also going to do a CT angiogram, and we're going to confirm the diagnosis of pulmonary embolism. We capture that diagnosis. It's all fully codified. We do populate that under the problem list, and that now will be subsequently be available for her next encounter. I'm going to discharge Cynthia. Over the course of 3 days, she's going to be put on some anticoagulants, and then once she's stable, we'll discharge her. So upon discharge, we will automatically generate another CCD document on Cynthia, and that will allow for us to create another document which can now be queried by other CommonWell members in our next episode of care. We can be responded to by HL7 FHIR transactions in this particular case, and CommonWell, being the true broker, can handle those requests. And I'm now going to pass it over to Jay Improbata so he can talk about his solutions.
Thank you, Joe. I'm Jay with Improbata, and it turns out that the hospital in Florida uses Improbata Patient Secure as part of their routine patient registration process. And when Cynthia was there for her episode of care, she opted in. So her palm was scanned, and her biometrically unique palm vein pattern was digitized and linked to her Meditech medical record. So going forward in the Florida hospital, for any future episode of care, her registration is swift and certain. All she has to do is put her palm down, and we are biologically certain that we have Cynthia. However, unfortunately, her next episode of care is not going to be in Florida. Her next episode of care is going to be in Colorado. She visits her daughter in Colorado, and she's an active 66-year-old. She goes out for a walk and slips on the ice. She's taken by an ambulance to an ED in a hospital in Colorado that is unaffiliated in any way with any of her provider organizations in Florida. And she's not doing well. She fell hard. Recall that she's 66, a little bit frail. She's in a lot of pain, and she probably has a concussion. So she's not coherent. In addition, when she goes out for her walks, she doesn't bring her identification with her. And let's also recall that in her episode of care in Florida, she was put on some medications that would be highly relevant for what's going to happen in the ED. But fortunately, the Colorado hospital has Patient Secure integrated with their Cerner system. And so the staff, per protocol, in the Colorado ED estimates Cynthia's age and sex, and then scans her palm, and almost immediately we know with biologic certainty that it's Cynthia that's in our ED. And so as a result of A, certainty about Cynthia's identity, and B, the fact that all of her providers so far in her journey have opted into CommonWell, all her records are available to the ED staff in the Colorado hospital.
Good afternoon, I'm Mike with Cerner, and I'm going to pick up the story from Baseline West Emergency Department where they're using Cerner FirstNet. So we have biometrically identified Cynthia, and we have registered her to the emergency department. Upon that registration, we've communicated with CommonWell and linked up her emergency department record to CommonWell so that we can pull information from her primary care provider in Florida and her last acute visit in Florida as well. Remember, we're in Colorado, and before CommonWell Network existed, we would have no access to this information. Cynthia would not be able to communicate her PCP. Using CommonWell's record location services, we will automatically be able to know this information, her previous visits, and pull down this information. So using ED Launch Point, I'm able to very quickly filter down to my assigned patient, who happens to be Cynthia. Remember, we're in the ED. She's in a lot of pain, so time is of the essence. I can very quickly open up my ED summary view, and I notice that because we're connected to CommonWell, we've actually gone and done that query in the background as soon as we link to that record. You'll notice that I have an indicator that says 4 new outside documents. So instead of starting with a blank chart now, I can actually go in and review some basic information about Cynthia before I start treating her. I can immediately see that she's got 2 allergies, a latex and a rocephin allergy. I see her current medications, at least the ones from her primary care in the last visit. I see that she has chronic pulmonary embolism, and she also has GERD. So immediately, where before I would not have any information, I actually have some good information to begin assessing and taking better care of Cynthia. Now, once it's time to actually see we've got her pain under control, now we can actually start treating her. It's time to start documenting our encounter. So I've high-level reviewed the external information, but now it's actually time to start including some of that information into my emergency department record. So as a provider, I'm going to start working through Cynthia's visit and actually starting to document some of this information. I can perform clinical reconciliation on this information and bring the discrete problems, allergies, medications, immunizations, and procedures into her local record in a codified manner so that our clinical decision support engine can fire off rules and alerts when necessary. And you can see that I have the opportunity to add her medications or discard them if I don't feel they're appropriate for my record as I update Cynthia's documentation. Now, ultimately, Cynthia gets admitted to the hospital. She's found to have a fractured hip, requires surgery. She has the surgery performed and ultimately is going to get discharged. But before she can go back home to Florida, she's going to have to remain in Colorado and have some rehabilitation services at the home, in the home health agency at her daughter's house. So we're going to go ahead and discharge Cynthia to home health. And when we discharge her, the FirstNet emergency department system in Cerner Millennium is going to put an HL7 CCDA document out in a CommonWell, just like eClinical Works and Meditech did, with the information that we acquired during our admission. That's going to be queryable for any future visits, either in Colorado or her home in Florida. Her PCP will be able to get all of that information back without even making a phone call. Also, not only are we going to put out that structured document, but we're also going to put out textual versions of the ED note and the discharge summary and a document that home health requires called a face-to-face document. And we do that with a technology called CDA wrap PDFs. Now they're not structured and codified, but they contain incredibly important clinical narrative and patient story that Cynthia's physicians are going to want to have in their record when she returns. So I am going to attach my CCDA so I can begin to transition her care to home health. And as soon as I send that CCDA, once BrightTree returns that CCDA, we're going to use direct secure messaging to send that information. They're going to be able to find my emergency department's medical record number, and they're going to actually be able to feed that up into CommonWell to identify Cynthia's CommonWell record and automatically link to it. So we're going to attach our transition of care record, and we are going to then send it using direct message, and I will let Carrie take it from here.
Thank you, Mike. Hello, everyone. My name is Carrie, and I'm here with BrightTree. Today, we're representing the home health. So just to recap, Cynthia is still in Colorado. She's elected to go home with home health, and she's going to stay at her daughter's house for a month or so while she has her rehabilitation. So we've received the referral from Mike over at the Cerner Hospital through direct secure messaging. He sent over a CCDA, an HL7 CCDA, and we're able to take that information. And first of all, if we had ever had Cynthia before, we would be able to reconcile that. Much of the information that comes over actually auto-populates into our system. And so you can see here we have a new referral, and we're able to pull it in and scroll through the information. And then a lot of this auto-populates into the system so that we save on intake time. Within that CCDA, he has sent over a medical record number, as he was just describing. We take that medical record number automatically, and using correlated linking, we go right into the CommonWell Health Alliance system, and indeed, Cynthia is a patient there, and they send information back to us. And then we're able to use HL7 Fire to actually do a query into the system. And what we're querying for is a list of encounters nationwide and any associated documents that we are able to pull back. So let me show you what that looks like. So we pull those in. It's really important to note that we can get information across the nation and not just from Mike here. That might be very helpful. But what we do is we give our customers, we give our customers a list of documents that they can choose from, because maybe some of the information isn't information that they want to pull into the system. Now, as Mike was describing, in home health, we have a document called the face-to-face. It's very important. It's basically the physician attestation that says that the patient qualifies for home health. Without it, home health is unable to bill. It can be very difficult to obtain. So it's really very handy for us that it's here in the CommonWell, and we can simply click on it and pull it in, review it, and determine if we'd like to save it to BrightTree. Now, anything that we get within the CCDA or anything that we query and retrieve and pull into the system is now going to be available to clinicians out in the field. So it's really important because they're going to have all of the information that they need to make informed decisions and be able to provide the care. So in this instance, we've saved a lot of calling back and forth. We've also, hopefully, we're improving outcomes and we're reducing rehospitalizations with this. Now, anytime that she's on home health, anyone within the CommonWell Health Alliance can query in and pull information about Cynthia's home health. Maybe there's a physician out there that would want to track vital signs or what have you. They're able to do that. Now, Cynthia is now discharging. It's been a month. She's gone through her rehabilitation at home. She's going to go home to Florida independently. And when she gets home, she's actually going to log into OneRecord and look at her information and be able to edit it.
Hi, my name's Morgan and I'm with OneRecord. And OneRecord is a freestanding personal health record that's managed by the patient and connected to CommonWell. So upon returning home to Florida, Cynthia is set to see a new orthopedist to evaluate her post-home health and establish a relationship should she need any assistance in the future. So to prepare for her visit, Cynthia accesses all of her patient records from the past 6 months using OneRecord. Cynthia already has an account and she knows that other people can't pretend to be her and access her records because she goes through an identity proofing process using Experian. So during that sign-up process, she's automatically linked within CommonWell and has access to care equality. If she wasn't already enrolled in CommonWell, then OneRecord would automatically enroll her. So here she can search for any records that she has at connected facilities by clicking Sync Records, and that sends out a query to CommonWell to see if there's any records about Cynthia throughout the care continuum. And you'll see that this has been done and she has 7 items in her files. So here we have the ED record from Baseline West, which is the Cerner facility, and we have that CCDA from BrightTree. We're going to click on this Baseline West transition of care and import this into Cynthia's record. She wants to make sure that she knows everything that went on with her care while she was in the ED. So this went through a duplicate checking process to verify that the information that was contained within that record wasn't already in her OneRecord. So no duplicates were found, and we're going to go back to her summary, and she's going to review her record. She looks at her lab results, her medications, her conditions, allergies, and she notices that when she was looking at her medications, there are 2 instances of the same medication but different doses. She knows that her doctor told her she's taking 40 milligrams and not 20, and so she's going to archive this 20 milligrams. So that goes down here, and it's now marked as inactive in her record. So the record that we then push back to CommonWell is an aggregate document of all of her encounters over the past 6 months. And now that instance of that medication, the 20 milligrams, is now marked as inactive in her record. So this is putting the patient truly at the center of their care and providing them with an incredibly powerful tool to help manage their healthcare and help them feel more in control of what is going on with their health. So now I'm going to pass it off to Corey, and he's going to tell you what happens at the orthopedist.
Okay, good evening everyone. My name is Corey. I am with Greenway Health, and we're going to be playing the role of the orthopedic specialist here in this use case, and this is going to be taking place in an ambulatory setting. So what we've seen so far is our patient Cynthia, who's traveled 2,000 miles across the country, gone through a series of different care transitions in multiple care settings, and then been released from her home health care to travel back to her home state of Florida. Now, upon arriving back in Florida, Cynthia was recommended to follow up with an orthopedic specialist, so she does just that. She calls and makes an appointment with the local orthopedist, Dr. Ford. Now, prior to meeting with Cynthia on the day of her appointment, Dr. Ford wanted to see if there was any available documents out there to get a background on her medical history. So he goes into Cynthia's chart here to look for that data. Now, upon opening this chart, there was an automatic transaction that took place in the background. And this was an HL7 Fire transaction that queried out to the CommonWell network to look for the current enrollment status that we can see here, indicated by the green check mark. So if you remember at the beginning of the demonstration, our friend at eClinicalWorks completed the enrollment process for Cynthia. So this green check mark does in fact indicate that she is currently enrolled. Now, one of the great things about the CommonWell services is that they have the ability to build these into the various solutions that you've seen here. So this same indicator, we're able to launch the CommonWell enrollment application from within inside the product. And at this point, we're able to see the different organizations that the patient has been associated with in the past. Now, Dr. Ford is familiar with OneRecord as being the personal health record, so he wants to look for that document because he knows that's going to be an aggregated document of the past medical history. So, one other thing to note, there was a second transaction that took place upon opening the chart initially, and that was a cross-community access or an XCA transaction that took place, and that queried out to the CommonWell network to look for these available documents. So what we're going to do is open up the exchange retrieval screen, and that's going to pull in these documents that we actually queried for initially. Now, there's an automatic XCA retrieval transaction that takes place that pulls these into this screen. And because we know we want to pull in that OneRecord document, we're going to have the patient-generated document right here, and it automatically retrieves that first document in the list. So we have this pre-populated. Now on the side here, you can see that the different sections on this CCDA are indexed. So if you want to quickly move to a certain section, we're able to click medications, for instance, and it takes you straight to that area of the document. Now, we're able to save this directly to the patient's chart. So rather than going into a separate retrieval screen each time to pull this document, we're able to pull it straight from the face sheet under this Exchange tab here. So we can see the document that we just saved straight inside of the chart. Now at this point, Dr. Ford was able to get the medical history of Cynthia, see her progress that's been made, and do his current evaluation. And he does see that she is continuing to heal well and does release her to pick back up on her activities of daily living and pick back up on her walks. The only piece of advice that he leaves her with is to stay away from the ice.
Okay, so I just want to quickly recap what you were able to see in our demo today. With nationwide care transitions, CommonWell is working together with these great 7 members to ensure that the care is centered around Cynthia. And that's really thanks to this nationwide network and services that have been put together. As you saw, we featured correlated linking, we featured the CommonWell broker and record locator service. You saw us use HL7 Fire to query and retrieve documents, as well as have direct patient access, which is a really exciting addition. And as we've all mentioned, this is built right into the software, so the providers really do have access to the care, and they have the control to choose what document they want to save, rather than just getting all the documents sent to them and them having to sort through it. And that really is about putting the patient at the center of care. And one of the things that we love the most is this is just not a demo. This is actually something we have live nationwide. There's 8,000 provider sites using this across the country. We're adding people every single day, and we really appreciate you all visiting us, and we'll welcome any questions that you may have.